Good morning expats and international students, and welcome to my channel Good Morning Expat. This is Bhor and I'm here with a brand new video in the Cost of Living in Italy series, which is a very important subject for future and existing expatriates in Italy. First of all, before starting this video, I would like to say that I really hope and pray that none of you ever have to go to a hospital or use a medical service, and that you and your families stay safe, strong and healthy for a very long time. But having said that, sometimes in life we do need medical attention. And that's when it becomes really important to know and understand the healthcare system of the place where you live, especially when you are a foreign citizen in a country. So today we're going to speak about the medical expenses in Italy, and we're also going to speak to a specialist doctor to learn about how the national healthcare system in Italy works. Italy has one of the best healthcare systems in the world, and it works on a co-pay or co-finance concept, wherein most of the costs are borne by the government and some of them are borne by the patient. The Italian national healthcare system, the SSN, which stands for the Servizio Sanitario Nazionale, is a tax-funded medical service. And to access it, you need to get the Tessera Sanitaria or the TS, which is basically the health coverage card or an equivalent card issued by another European member state. This equivalent card is called the EHIC card, which stands for the European Health Insurance Card. And once you have it, you're entitled to the same treatment and services just like any other Italian or European citizen. Any foreign resident who has a valid resident permit in Italy or in another European country can avail it, and basically the validity of your health coverage card will be the same as the validity of your residence permit. To get your Tessera Sanitaria, you need to approach this office, which is called the ASL, which stands for Azienda Sanitaria Nazionale, which are these regional units located in every city. For example, one of them is this one that you can see behind me, which is the ASL of the 9th zone in Milan, which is located on Via Livigno. The national healthcare system of Italy includes a network of primary care physicians, also known as general practitioners, and pediatricians. Once you're registered in the system, you will have a doctor at your disposal, which will be your Medico di base or your general practitioner or the primary care physician, as you would like to call it. And this will be the person responsible to give you the first consultations in case of a medical requirement, or to give you a referral to a specialist doctor in case you need to visit departments like dermatology, cardiology, ENT, or some other specialist branch of medicine. Since all the systems in Italy are internationalizing a lot, it is now possible also to choose from a list of doctors who are English speaking, or also from a list of doctors who speak other languages like German or other common European languages, but even some other local Asian languages as well. You will be having access to this list when you go to the ASL to get your TS or the Tessera Sanitaria done. The Medico di base or your GP is also the person who is going to give you medical prescriptions or refills in case you want to buy medicines which are not sold over the counter, like antibiotics, steroids, or injections, for instance. So very important question now. What is the cost of visiting your Medico di base? The cost is absolutely free. So all the consultations with your general practitioner are absolutely free. You can visit them during the operating hours at their clinic in presence. You can also avail a video or teleconsultation with them over phone or through a Skype call, for example. And in emergency cases, they can also provide a visita a domicilio, which is like a house visit in case it is required. For instance, we are talking about an elderly person. And no matter what was the mode of your consultation with the doctor, the prescription that they will release will have the same value when it comes to getting a next specialist visit or getting a medication from a pharmacy. So the cost of the first visit at your base doctor is free, but where the co-finance system comes into play is when you need to take a specialist visit or do a lab test. When you need to do a specialist visit, for example, with a cardiologist or in the ENT department or at a dermatologist, for example, then your base doctor is going to give you a document which looks like this. And with this document, you will be able to book a specialist visit in a specialized faculty, or you can book also a lab test. Now let's see how to book an appointment. There are two ways of doing it. The first one is by phone. In the Lombardia region, you can do it by calling the toll-free number 800-638-638, or you can also call on the paid number, which is 02-999-599. The second way is to do it online. You can access the website prenotasalute.regione.lombardia.it and enter using your SPID account, which is a unique digital ID account that allows you access to almost all public service portals in Italy. If you don't have this, there are other login methods too, like using the number of your health card to access the website. On the same street via Livigno, you can also find one of the centers belonging to Ospedale Niguarda, which is one major hospital in Milan. So we spoke about the co-finance or co-pay system, and generally speaking, what you will pay from your pocket for a test or a specialist visit is about 10% of the actual real total cost of that service. The rest is of course funded by the SSN system. For example, last year, I had to do a visit at a dermatologist and I paid a ticket of 17 euros, which is basically only the cost to get my turn, also indirectly called a ticket, like getting a ticket to get your treatment done, and the rest is then financed by the SSN. In these cases, you pay for the first visit at a specialist doctor, which is called a prima visita, and then the follow-up visits are usually free. So this is to say that if the total cost of a certain treatment or of a certain test is 100 euros, what you will be paying is about 10% of it, that's 10 euros. So you can see that these services are highly subsidized by the SSN system. If I had to take, for instance, last year, the same service at a private facility, it would have costed at least between 100 to 150 euros, which means that the subsidization level is very high. And this does not mean that the quality of the service is compromised. So in all the public healthcare setups, you can expect really high quality and serious service, just as if you would avail in a private setup. The only drawback of relying on the public system is, of course, the long wait periods. So in one source, we found that around 44% of Italians are now turning to the private healthcare system just because of the wait times, which can go in some cases to up to 120 days, which is around 4 months of wait time. So if you want a faster service, then yes, the private healthcare facilities come into play. But otherwise, you can safely rely on the SSN, which is the national healthcare system, the public one. And also in private setups, those that are accredited by the SSN, you can actually avail a service in a private facility, but using the funding by the SSN. What is the meaning of privato convenzionato in private hospitals mainly?
Yes, well, in Italy there is a quite strong national healthcare system, but there are also private hospitals that have a conventional with the healthcare system. So if you are treated in one of these hospitals, then it's as if you were taken care of in a public hospital. So it's really for the patient is just the same, because
Okay.
there's an understanding between this private hospital and the healthcare system. So you receive just the same type of, for example, visit or exam, and you should not pay, because then it's between the private hospital and the healthcare system to manage this type of situation. But it's really equivalent for a person who enters the system.
Okay, so this means that in case there is a lot of waiting time to access a private facility, to access a public facility, you can actually go to a private setup as well and
Yes,
avail the same services if it is accredited with the SSN.
exactly. So you should go with the impegnativa, which is the type of paper that redacts the doctor that requests, for example, the exam. And you can do the same exam you would do in a public hospital, in a privato convenzionato. It's the same. Of course, in the privato, you can also pay, for example, for your exam. And this is a private, for example, type of exam. But you can also do everything with the national healthcare system.
Okay, great. About the average wait times, so it's up to 120 days, not for all types of services, but for certain services. In some cases, you can get your test or a specialist visit done even faster or even later than 120 days, depending on the nature of your test or the nature of your visit. The second important question, what is the cost of getting your SSN or getting registered in the social system? So if you are an expatriate and you're working and you pay taxes regularly, then of course it's entirely free for you. On the other hand, if you are an international student, the cost is going to be 149 euros and 77 cents per calendar year, which means that irrespective of when you avail the service will last until the end of the year, which is 31st of December. So in case of most international students arriving, for example, in the fall intake, which is usually around September, October, what they do is that they make use of the healthcare package that they took, like an insurance, which is also a mandatory requirement for getting your study visa when you apply for a student visa. They use that until the end of the year, and then towards January, they can get themselves registered in the healthcare system through the ASL, one of which we just saw in Via Livigno. And what are the documents that you will need to actually get yourself registered? The list is very simple. Once you have arrived in Italy and you have your codice fiscale, which is the physical code, the documents basically look like this, that you need to present at the ASL to get your health card. Once you're registered in the system, it's mostly automatic and instant. They're going to give you at the ASL a Tessera Provisoria, which is like a provisional card, which is usually paper-based. And using that, you can already start availing all the services. And then there is a physical plastic card that is going to come at your residence in some days. So if you have a dependent family member, like a spouse, child, or an elderly family member, then you can still avail the services of the SSN by paying an annual cost. And the amount of this annual cost will be a certain percentage of your annual salary. So the actual figure depends on your annual base salary as the earning member. The three categories for which you need to pay a part of the cost are specialist visits that you have to take in special faculties of medicine, for treatments taken in an emergency room which are not of an emergency nature, and for aesthetic and spa treatments. Then there are certain categories of treatments or exigencies for which you are not required to pay any part of the cost. These include the apparatus and equipment that diabetes patients require, like needles, test apparatus, etc. Also, things required for patients or foods required by patients having chronic allergies. All the services that you need during a hospitalization event. So if you have been hospitalized, then all the services, of course, are entirely covered. And the last two are equipment needed for disabled people, and also the tests that are conducted to curb contagion diseases like COVID. There are some other types of services as well, in which case you are entirely covered by the SSN, which include maternity-related services, also in case of HIV detection, for example, and also to take vaccinations. Another type of service in which you are entirely covered by the SSN would be the emergency room services. So if you go to the emergency room and you are classified, meaning your exigency is classified under the following 3 codes, then you're not going to pay anything, which are the red code, the green code, and the yellow code. And to learn more about the emergency room services, we will now speak to Dr. Okay, can you tell us about the emergency services in hospitals?
Well, emergency services in hospital are generally free for everyone who needs it. So whether you are an Italian citizen or not, if you really are in need of an emergency care, you will be taken care of. And afterwards, there are people in the hospital that will help you to understand how to manage this type of situation. But you will be taken care of with regard to your health.
Okay. And can you explain something also about the code system in emergency rooms?
Yeah, there are different color codes. So there is the first person that approaches you is called triage, and it's usually a nurse with a specific experience in the field that gives you a priority code, and this is done by assigning you a type of color.
Correct.
There are colors that are problems of health that can wait a few hours, for example, or even 24 or 48 hours, and there are codes that need to taken care of right away. So this gives you a kind of priority. So then the healthcare professional that follows knows how to treat you, how fast, how to manage the type of situation.
Right, I believe the codes are red, yellow, and green.
Yes, they're a little bit more complex nowadays, but generally speaking, yes. So if you're a red code, you literally rush into the emergency room and you're taken care of right away.
Okay.
If you're a yellow code, yes, you are managed rapidly by the physician, but you can wait some minutes, for example, and if you're a green code, you have to wait a few hours. Just let the healthcare professional take care of the urgent codes before they get to you.
Okay, great. And in case someone does not have a private insurance and or coverage with the SSN, then how are such patients treated?
Well, it depends on some factors. For example, if you are a citizen from the European Union or outside European Union, but there are several types of modules you can fill, of procedures you can do to being taken care of by the national healthcare system. For example, from citizens that are not from the EU, there is, for example, an STP code, which enables the patient to receive care for a quite urgent, let's say, or important matter of health. Okay. So even if you are not registered in the national healthcare system, you can be taken care of.
For example, if you are an international student and you just arrived and you're waiting for your SSN to be done, but you met with an accident, unfortunately, in this case, you will still receive the required treatment.
Well, yes, if it's a real emergency and you go to the emergency room, yeah, you will be taken care of. But also if you have some, for example, exams to do for a really serious matter of health and you are not, for example, okay with all the papers, then there are also other types of escape routes to get to be taken care of.
Okay, great. I believe Italy is one of the few countries in the world which have this kind of a system in place, which is very responsive to the needs of patients, whether they are foreigners or locals.
Yeah, well, we of course, as in Italy, we'll find a way. But yes, you will receive all the care you need, and all the bureaucracy will be straightened up afterwards.
Okay, great. Great. Thank you very much.
Thank you.
So I hope that this information was useful for you. And if you liked watching this video, do hit the like button and subscribe to my channel Good Morning Expat, and hit the bell icon to stay updated about my next videos in the Cost of Living in Milan series.